Do your legs feel numb, heavy, or tired when you are walking? Do you need to sit down multiple times if you need to do long walks? This could be signs of spinal stenosis. The lower spine or lumbar spine contains spinal canal. This is where nerves pass through to your legs. In healthy spine, this canal has enough space for the nerves to function normally in all lumbar position, be it bending forward, backward, or sideways. No problem. Lumbar spinal stenosis happens when this space narrows, often due to aging. So putting a lot of pressure on the nerves, this can lead to leg pain, numbness, weakness when walking or standing. 10 to 30% of people over 60 show evidence of spinal stenosis. What causes spinal stenosis? Spinal stenosis is usually caused by aging, wear and tear, or degenerative changes. Common causes include arthritis, wear and tear in the joint, in the facet joint. The joint becomes bigger and encroach into the spinal canal. The second one, thickened ligaments that holds the bones together become thick and causing narrowing in the spinal canal. Also, bone spur. Bone spur can grow into the spinal canal as well. Then, lastly, bulging discs. The discs wear out, become thin, and bulge into the spinal canal. All this together causing narrowing of the spinal canal day by day. Sometimes nerves can adapt to the changes. They may shift slightly to areas with more space. If they can do that, they may have minimal symptoms or sometimes no symptoms at all. However, once the narrowing traps the nerves, they can no longer compensate. Then symptoms like pain, tingling, numbness, weakness in the legs begin to appear. Is spinal stenosis dangerous? People don't die from it, but it can greatly impact the quality of life. If left untreated, severe spinal stenosis may lead to permanent nerve damage, resulting in weakness, numbness, or even bowel and bladder problem. Once nerves are damaged, recovery is difficult, even with surgery. Surgery can only free up the nerves, but the repair of the nerve damage needs to be done by the body itself. But the requirement for healing is the nerve must be free. Paralysis from untreated spinal stenosis is extremely rare. You may heard that people say if you don't treat spinal stenosis or nerve compression, it can lead to paralysis. But to tell you the truth, I never see people paralyzed because of spinal stenosis in the lumbar spine. So, if you are considering surgery, it should be to improve the function, relieve the symptoms, not out of fear of paralysis. Early diagnosis and proper treatment are keys to preventing long-term complications. Spinal stenosis is recognized by the symptoms. So if you have leg pain, cramp, tingling when walking or standing, and improves by sitting, you may have spinal stenosis. You need to recognize these symptoms, and if you do, you need to see your doctor. An MRI scan is used to confirm the diagnosis. It can give us details like where and how severe the nerves are compressed. X-rays are also important to detect spinal instability, which can occur together with spinal stenosis. So knowing spinal instability is important for appropriate treatment plan. Walking, swimming, cycling, or gentle stretching are generally safe and helpful for spinal stenosis. Core strengthening exercise can also provide good support, stabilize the spine, but avoid high-impact activities like running, jumping, heavy lifting, even if you have a good form. Heavy lifting can worsen spinal stenosis. Also, stay clear from movements that trigger back pain or leg pain. But stay active is important, so move as much as you comfortably can. What are the treatment options for spinal stenosis? Treatment starts with non-operative or conservative methods like physical therapy, pain medication, anti-inflammation, and sometimes steroid injection. If symptoms don't improve, surgery may be considered to relieve pressure on the nerves. The nerves cannot be left compressed for a long time. It can cause nerve damage. The right treatment depends on your symptoms and how they affect your life. Do I need surgery? Not everybody needs surgery. Many people with mild spinal stenosis actually improve with conservative treatment. Surgery is usually considered when symptoms are severe, disabling, and not responding to the treatments that I mentioned previously. Surgery is strongly advised if you have progressive weakness in the legs or bowel and bladder problem. Then you need to have surgery. That's all about spinal stenosis. Let me know if you have any topics that you want me to discuss. And if you have any question, you can write it down in the comments. Otherwise, see you again next time. Bye-bye.